Our session today is about the perineum. As I said before a while, the perineum is a space lie to the skin, deep to the skin of the lower trunk. This region, the lower trunk, if we consider it on that sample, of course, you know that sample. It is the sample of the ligament, sacrotuberous ligament and sacrospinous ligament, right? You know that sample. You had studied it previously. The sample, you can imagine that below this pelvis are the right thigh and the left thigh, right? Here are the attachment of the thighs, right? So this is the perineum. This is the perineum where I'm putting my pen. It encloses the skin, or it lies deep to the skin, covering the lower trunk. Therefore, I can use another term for this definition, which is, it is the soft tissue closing the pelvic outlet. What is the pelvic outlet? In the bony pelvis, we had learned something that this is the inlet of the pelvis. Above it is the false pelvis, which is posterior abdominal wall formed by the iliac fossa. But below the inlet, this is the true pelvis. And this inlet is a closed circle formed by the promontory of sacrum behind, the pubic symphysis anteriorly, and on the sides, linea terminalis. This linea terminalis is formed by the anterior border of ala of sacrum, then arcuate line of ilium, then pecten pubis, then pecten crest. This is the pelvic inlet with the promontory posteriorly, symphysis posteriorly, and linea terminalis on the sides, on the right side and left side. And this inlet, above it is the false pelvis. Below it is the true pelvis. The false pelvis is part of the posterior abdominal wall. But the true pelvis is the pelvis that we are studying. This is inlet. I'm insisting. This is inlet. I will turn this sample on the other side from this side. Okay? This is the ischial tuberosity. You sit on the ischial tuberosity. This is the coccyx. And this is the lower border of symphysis pubis. This region is the outlet. The outlet is diamond in shape. It is formed posteriorly by the coccyx, anteriorly by the symphysis pubis. On the side, anteriorly by inferior pubic ramus, ischial ramus, and ischial tuberosity, while posteriorly on the sides, it is formed by the sacrotuberous ligament. So I'm talking about the perineum. I'm not out of the subject. This diamond, which is diamond pelvic outlet, which is formed anteriorly by the symphysis pubis, posteriorly by the coccyx, on the sides, posteriorly sacrotuberous ligament, and anteriorly ischial tuberosity, ischial spine, and inferior pubic ramus. Ischial tuberosity, ischial ramus, and inferior pubis ramus. This diamond outlet is closed by a tissue, soft tissue, which is the perineum. Right? This diamond. So the perineum is a diamond-shaped space between the two upper thigh, or it is the lower part of the trunk. Because the outlet is diamond, so the perineum is diamond. It has four walls, four borders. right? Now, I will divide this perineum, the diamond, into two triangles. How is that? I will connect the ischial tuberosities together by my pen. I will connect the ischial tuberosity by my pen. I will do an interischial spine. So the diamond will be divided into an anterior triangle and posterior triangle. Anterior triangle is just near to the pubic symphysis, posterior triangle near the coccyx. The anterior triangle, which is this one, is called urogenital triangle because it contains the urinary urethra and genital organ, external genitalia. While the posterior triangle is called anal triangle because it contains the anus. Right? This is on this sample. I want to describe the urogenital triangle and the anal triangle on living because in surgery I will need to know where is the perineum, right? So I will put surface anatomical boundaries. This is deep anatomical boundaries. What is the surface anatomical boundaries that divides the perineum, which is diamond, into anterior urogenital triangle and posterior anal triangle? The anterior urogenital triangle is bounded anteriorly by the scrotum instead of the pubic symphysis as shown here, right? And in female, it is bounded by the mons pubis. Okay? Posteriorly, it will be bounded by the coccyx. And then you can feel the ischial tuberosity because it is prominent on your buttock, and therefore you can feel it and draw the diamond. You can feel on living in coccyx, posteriorly, mons pubis or scrotum, it's clear, ischial tuberosity are clear, and you can draw a diamond. This is the perineum, right? As a space, as just like this room, it contains boundaries, floor, and roof. Don't forget. Okay? Of course, my hand is now the soft tissue that is closing the outlet. So my hand is the space. Okay? So the floor is this one, is the dorsum of my hand. The floor is the skin of the lower trunk, the skin between the right and left upper thigh. This is the floor. What is the roof of this space? The roof is the levator ani muscle. You can imagine that? The roof is levator ani muscle. If you perforate the roof, which is levator ani, you will be in the true pelvis. You are not in the perineum because you perforate levator ani. So now you are in the true pelvis. Right? Let us see this configuration on that sample. Of course, all the samples are shown to you previously. Here I'm putting levator ani in its position, right? Huh? So my pen now is in the in the perineum because this is the roof of the perineum. And if I put the mask here, it will be the skin of the lower trunk. And the space between the mask and levator ani is the perineum. Right? And this perineum, this space, I hope you get it. This space, the perineum, is divided, this space could be divided by my pen, the interischial spine, into a posterior triangle that contains the anal canal. This is the anal canal, and the anterior urogenital triangle. Right? And it is a diamond space. That's why the manufacturer made this. It is placed just like that. Okay? This is the perineum. This is the piece of perineum. Right? The manufacturer now dividing it into an anterior triangle. بتشوفوا التراينجل هذا بيه الفاجينا الفالفا هي. The posterior triangle contains the anal canal. Although the anterior triangle is represented triangular, right? But the posterior triangle, which is the anal triangle, here we can see that the manufacturer of this model did only the anal canal. Why? Why he didn't draw a triangle posteriorly, which is anal triangle, just like the urogenital triangle? Because the posterior anal triangle contains only in the middle anal canal, and on the right and left side of the anal canal are fossa, which are called ischiorectal fossa. That's why he left the space on the sides of the anal canal, because this is the ischiorectal fossa. Why I'm so excited to explain that? Because most of you have some discharge of pus in this region, many patients, and you don't know that it is a fistula, nasur. The fistula occurring here in the anal canal on the sides of the anus. The fistula is a canal which is formed by recurrent infection of the hair follicle. And this infection results in pus in the ischiorectal fossa. And the pus will rupture to outside, and thus pus will come outside on your underwear. And also the pus will be from inside the anal canal or rectum. And so you'll have a canal which have two openings. One of them is outside, getting pus to outside, and the other is to in the rectum or anal canal. Any canal with two openings is called fistula, nasur. Okay? So the ischiorectal fossa are sites for fistula. Okay? And when you do an operation for the fistula, you have to remove all this canal. So you have to تحفر بالعربي. تحفر على القناة حتى يخلون سيم ويحفر عليها. وين المشكلة؟ إذا الكنال كلش قريبة من الأنس راح تضرب السفنكترز of the anus وينتهي بعد العملية ما يسيطر على الخروج. يسموه incontinence to feces. بعد ما يسيطر طول عمره على الخروج. لأن أنت بدك تحفر تطلع الكنال مال الناسور ضربت الاكسترنال انال سفنكتر بعد ما يقدر يسد الانس مالته الخروج مالته يطلع عادي. صارت شلون؟ الخروج مالته يطلع عادي انه راح تسوي عمليه على الاسكيوريكتال فوسا تضرب زين. شوف انا كعملي ما احكي مثل النظري. تشوف الحكي شلون دا يصير؟ انا دا ادليك المنطقه وين. الثيوري يحدد فلان نيرف الروت مالته شنو مو؟ طيب. فهسه نجي نحكي كل وحده من ذول التراينجل. الانال تراينجل شنو بي والامامي اليوروجينيتال تراينجل شنو بي؟ هو هذا التراينجل خلاص. اوكي؟ نبدي بالانال تراينجل لانه هو اسهل تراينجل بالنص الانال كانال. فهو على جانبيه اسكيوريكتال فوسا. نجي نحكي على الاسكيوريكتال فوسا، طبعا الاسكيوريكتال فوسا مليانه دهن. اوكي؟ نقول الاسكيوريكتال فوسا الباوندري مالتها ميديالي الانال كانال او نقدر نقول السفنكترز مال الانال كانال. بينما هذه هي الاسكيوريكتال فوسا الباوندري مالتها ميديالي اكسترنال الانال سفنكترز او انال كانال. لاترالي الباوندري مال الاسكيوريكتال فوسا هاي العضله اوبتريتر انترنس راح تقول لي وينها obturator internus؟ راح اضطر اشيل هاي وراك اياها. هاي obturator internus تسوي الانتيرو lateral wall of the true pelvis. مو عندنا anterior obturator internus وposterior هنا على الساكرم piriformis، دول هم الوول. posterior laterally piriformis يم الساكرال foramen، وانتيرو laterally هاي obturator internus. obturator internus بتصل بيها ليفاتور اني اللي سان شلتها، بحيث obturator internus تقدر تشوف بيها جزئين، جزء من ذيك الجهه وجزء من هنا بالبرينيوم. عرفت شلون؟ شكرا. ماشي؟ فالاسكوريكتال فوسا بس طبعا ورا ما وخرنا ذاك النموذج او So, this is the anal canal, and as I said, on the side of it is right and left ischiorictal fossa, as was shown with this piece. This is ischiorictal fossa. The ischiorictal fossa is bounded medially by the anal canal, but laterally it is bounded by obturator internus. And I will remove this piece to able to continue on. Here, the obturator internus forming the lateral wall of ischiorictal fossa. On it, just like where I'm putting my pen, is a facial canal which is called Urogenital Canal or Alacrop Canal. So the Alacrop Canal is in the lateral wall of the ischiorictal fossa, inside or on the fascia of obturator internus. There are much details about that regarding to lunate fascia and other. But this is the site of the pudendal canal. It is on the lateral wall of the ischial fossa attached to fascia of obturator internus. The ischiorictal fossa extends anteriorly. I will attempt this piece. The ischiorictal fossa, which is this one, extends anteriorly a little above the urogenital diaphragm. This is the urogenital diaphragm, and this ischiorictal fossa have slight extension above the urogenital triangle, which is called anterior recess of ischiorictal fossa. And posteriorly, where I'm putting my hand, this is the sacrotuberous ligament covered by the gluteus maximus muscle. And again, the ischiorictal fossa extend deep to sacrotuberous ligament and deep to gluteus maximus, which is represented by hand, forming posterior recess of ischiorictal fossa. This is mostly about the ischiorictal fossa and the posterior urogenital triangle, anal triangle. I will come back to the urogenital triangle, which is this one. The urogenital triangle is closed by this diaphragm. You can see, this is a triangular piece of soft tissue closing the triangle of the perineum, and this triangular piece closing the urogenital triangle is called urogenital diaphragm. The urogenital diaphragm is formed by two fascia, superior fascia and inferior fascia. And in between these two fascia are muscles, which are muscle surrounding the urethra, which is called external urethral sphincter, and a muscle behind it, which is called transverse deep perineum muscle. So, you know, this is the lower part of the urogenital triangle because it is just like that. So I will turn it just like that. What is this white color? This is the superior fascia of urogenital diaphragm. And below this, the redness here is the muscle, which is anteriorly sphincteric urethral muscle, because this is the urethra. So this is the sphincteric urethral muscle. And behind it, this is the deep transverse perineum muscle. After the red, you can see also a white. This is the superior fascia of urogenital diaphragm. So this white is a superior fascia of urogenital diaphragm. This fascia is the superior fascia of urogenital diaphragm, while this white is the inferior fascia of urogenital diaphragm. And the redness between them is anteriorly sphincteric urethra surrounding the urethra, and posteriorly deep transverse perineum muscle. The muscle and the two fascia are called urogenital diaphragm. The muscles here, in between the two fascia, are called to be inside the deep perineal space. So you can say that the deep perineal space contains sphincteric urethral muscle anteriorly and deep transverse perineal muscle posteriorly. And this deep perineal space is surrounded by superior and inferior fascia of urogenital diaphragm, and thus forming the urogenital diaphragm. Of course, this is the urethra and this is the vagina, perforating the urogenital diaphragm. So, this is superior fascia of urogenital diaphragm. This is muscle. This is inferior fascia of urogenital diaphragm. But after the inferior fascia, you have another redness. This redness is a muscle in the superficial perineal space. And the superficial perineal space, below it, which is represented now by my hand, is the skin and superficial fascia. Consider that my hand is the skin and superficial fascia, and then there is a muscle, and then there is an inferior fascia of urogenital diaphragm, then there is sphincteric urethral muscle, then there is a deep fascia of urogenital diaphragm. So the superficial perineal space is between my hand and the plastic model containing these muscles. So if you want to say what are the boundary of the superficial perineal space, you will say above is the inferior fascia of urogenital diaphragm. Below is the skin and superficial fascia. But specifically, we must say something about the floor. Right? It is the skin and superficial fascia. But mostly anatomists say that it is superficial fascia here, which is called Colles fascia because it is membranous. Colles fascia is a superficial membranous superficial fascia. Just like in the abdomen. You have in the abdomen superficial fatty layer of camper and deep membranous layer of scarpa. These are both superficial fascia, but two layers. Here also the superficial fascia is formed of a fatty layer which is continuous up with the fatty layer of the abdomen, and membranous layer which is also continuous up with the membranous layer of the abdomen. Here the membranous layer is called not scarpa. The scarpa is for the abdomen. It is called Colles fascia. Okay? So now I'm looking to the superficial perineal space, right? You can see this muscle in the superficial space. This is ischiocavernosus muscle, covering the crura of clitoris, while this muscle is the bulbospongiosus muscle, covering the bulb of the clitoris. Both of these are synonyms in male. You have ischiocavernosus muscle covering the crura of penis, and bulbospongiosus covering the bulb of penis, which is root of penis. And the manufacturer here, perforating the urogenital triangle to show the white color here, representing the inferior fascia of urogenital diaphragm. If I remove this white color, which is inferior fascia of urogenital diaphragm, I will see above it the sphincteric urethral muscle. And if I remove the sphincteric urethral muscle, I will see the superior fascia of urogenital diaphragm. Okay? Finally, we have a synonym. The inferior fascia of urogenital diaphragm sometimes is called perineal membrane. The inferior fascia of urogenital diaphragm, not the superior, is called perineal membrane as a synonym. So let us ask a question. This is bulbospongiosis covering the bulb of clitoris. What is this? Here bulbospongiosis is removed, so this is the bulb of the clitoris. Right? And this is the clitoris. Returning back to the external genitalia, I had said something in the last lab. Here's the external genitalia of female. The external genitalia of male have been discussed with the abdomen. But here, this is the external genitalia of female. It is formed of this space, which is called vestibule of the vagina or vulva, that contain the vaginal orifice and the urethral orifice. And this vestibule containing the vagina orifice and the urethral orifice is surrounded on the sides by the labia minora. The labia minora splits anteriorly to enclose the clitoris to form what's called the prepuce, and more lateral on the sides of the labia minora is the labia majora, right? And you have seen that in the previous sample. Let us go further. I will go further. That sample that I had just demonstrated will not represent the perineum really on human. That sample is more clear. Where's the perineum here? This is the anal canal, right? And this is the sphincter of the anal canal. So this is the perineum. And this is a fibrous tissue about centimeter anterior to the anal canal in the midline. Anybody know what is this fibrous tissue? This is the perineal body. Just look to this nodule of fibrous tissue, which is the perineal body. It is very important. Why? Going back to this sample, this is the anal canal, and anterior to it, this is the perineal body, fibrous nodule. It is lie in the middle of the interischial spine. The perineal body shows attachment of, I think, 9 muscles, I think. I don't know the number. And some of these muscles are those of the urogenital triangle. For example, bulbospongiosus is attached to the perineal body. Ischiocavernosus is superficial and deep transverse deep perineal muscles. The external anal sphincter, the levator ani. So, because the perineal body is a fibrous tissue in the midline of the interischial spine, and it shows attachment of many muscles, it to provide supports to the perineum and support to the pelvic floor, which is levator ani. And so what? Sometime during labor, the baby gets out of the vagina from here. And the baby head is very big. It is the largest size of the body of the baby. So there will be tear in the vagina, in the midline, and this tear will extend to the perineal body. Okay, the baby gets out and you will suture it. But the perineal body will never get back to its full strength. It will remain healed by fibrous tissue, but it is weaker than the original. So after this midline tear in the wall of the vagina, in the midline posteriorly, there will be prolapse of rectum, prolapse of anal canal, prolapse of vagina or uterus. They will get it outside because you have a midline rupture in the perineal body, the posterior wall of vagina extending to the perineal body. Therefore, to avoid that, if the doctor noticed that the opening of the vagina is so tense when the baby is exit out of it, sometimes it will not be tense, but you can feel, you can put your finger, and if you feel that the wall is so tense that it may rupture. So you have to take a scissor and do an incision here, obliquely, not in the midline posteriorly, obliquely posteriorly. This incision is artificial done by scissor, while the baby head is out of the vagina, is partially out of the vagina. This incision is called episiotomy. Okay? So that you can make the baby get out and you can suture it and it will heal without resulting into weakness into the perineal body that is resulting in a prolapse of the viscera. So from that we may go back to that sample. This is the perineal body. Notice how deep to it. Epitel, levator, any is attached to it, right? This is the bulb of penis. It is covered by bulbospongiosis. So this is the perineum. So if I'll find opening here on the right side of the anus and pus exit from here. What is this? Nasur, fistula. This is the skin of the lower trunk. This is the ischiorectal fossa. This is the ischiorectal fossa. This is the perianal space. All of this is the perineum. So here the nasur will be just like that. A canal on the side, lateral to the anus canal. And because of that, when you want to remove this nasur, you will damage the muscle of the anus canal, resulting in incontinence of feces. So this is the ischiorectal fossa. This is the perianal space. Both of them are filled with fat, as you can see. The difference in between these two, the fat in the ischiorectal fossa and the fat in the perianal space, not perineal, perianal, is that this fat in the perianal space is surrounded completely by loculi of fibrous tissue. طوبات صاير بالperianal space. ولهالسبب احيانا جذر الشعر هنا يلتهب. وين ينقل الالتهاب؟ للدهن اللي بالperianal space. هذا الدهن اللي بالperianal space محاط بطوبة من fibrous tissue. تتجمع الجراحة ما تطلع محصورة، مو هاي طوبة بها جراحة بتوجع. شو يسموها؟ perianal abscess. يجي المريض يقول لك دكتور مدى اقدر اقول؟ لانه باص متجمع بهاي الطوبة اللي جاية الجائحة من التهاب جذر شعره، وهذه طوبة متجمع بها جراحة، يريد يقعد ما يقدر. شوف شلون ترى عاد سويته؟ تجي على المكان تلقاه منتفخ دعبله صاير، تفتح بيه طلع له الجراحة مالته. خليه زين، تفتح هنا تطلع له الجراحة، تقدر تسويها بالعملية وبنجعان يرتاح المريض، لأنه هذه اللوكيلي. اكو واحد مهم يظل الى ان هاي الطوبة اللي بيها دهن ومحاطة بفايبرس تشو طقت. من طقت راح تنتقل للطوبات اللي يمها، وهمينه قام توجعه وما يقدر يقعد، تركها طقت تركها. ايش قام يصير؟ هواي طوبات هنا بالبرينال سبيس. وين وصل الالتهاب؟ لي فوق الدهن بالسكوركتال فوسيت. الدهن بالسكوركتال فوسيت اكو بيه فايبرس تشو بس ما صاير بشكل طوبات، لوكيول يسموه. بعد ما يحس بألم، يقوم كل فترة يطلع جراحة وتروح، يطلع جراحة وتروح. شو يسموه هذا؟ ساينس، ناسو ما أعرف العربي، جيد يعني، مو أبسس، ساينس. من كان مسدود ومحصورة جراحة وتوجع، هذا أبسس خراج. بس من بعدين طق وتلتهب، طق وتلتهب، صارت قناة بس بها فتحة واحدة لي برا، وبيحس ألم لأن السكيرتال فوسي الدهن ما محاط بفابرس تشو، بس كل فترة طلع على اللباس مالته صفار. صار ساينس بفتحة واحدة. يظل التهاب وين يروح؟ للأنال كانال، صارت فتحة بالأنال كانال أو بالركتام وفتحة لي برا، صار بي فتحتين، صار ناسور فيستولا. صورت شلون؟ راويك بتشي دختلوا بعدكم. باوع هنا، هذا شايفين نموذج، هاي المثانة صح، يورانر بلادر، وهاي بروستيت. This is the prostate، مو؟ اليوريثرا اللي بالبروستيت شو اسمه؟ بروستاتيك يوريثرا. بعد هذا اليوريثرا ممبرينس يوريثرا. هو هذا ليش سموه ممبرينس يوريثرا؟ هذا صاير يمشي باليوروجينيتال دايفرام. هذا اللي هسه قلنا بسوبيريور فيشيا وانفيريور فيشيا وبيناتهم سفنكتريك يوريثري عضله، واللي هو ديب برينال سبيس. اذا لو تباوع هسه بهذا النموذج تشوف هذا ديب برينال سبيس. ليش رسمي احمر؟ لان هذا السفنكتريك يوريثري ماسل اللي تحيط بهذا اليوريثرا اللي هو البينال يوريثرا، العفو الممبرينس يوريثرا بعد البينال. فهذا الديب برينال سبيس. يعني اذا اشير لك هنا تقول لي هاي superior fascia of urogenital diaphragm، واذا اشير لك هنا تقول لي هاي inferior fascia of urogenital diaphragm اللي يسموها perineal membrane، واذا اشير لك هنا هذا perineal body، مو؟ وهذه anal canal، وهذه squirtal fossa، وهذا perianal space، مو؟ هذا شنو الابيض؟ هذا يسموه anacoccygeal ligament. هذا وهذا anacoccygeal ligament. نشوف على الإيميل. هذا هو اليوترس وهاي هي الفاجينا، مو تمام؟ اوكي، وهاي هي الانال كانال. هذا شنو هو الابيض؟ perineal body، perianal space، anacoccygeal ligament، هذا squirtal fossa الدهن. نشوف شلون؟ هذا الانال كانال، هذا perineal body، البرينيال body امام الانال كانال. راح اجي لي قدام هاي الفاجينا. الفاجينا perforating the urogenital diaphragm. هذا الابيض هو urogenital diaphragm. يعني هذا superior fascia of urogenital diaphragm، هاي inferior fascia of urogenital diaphragm. وهذا هسه اذا اشير لك شو تقول لي؟ تقول لي هذا superficial perineal space. واقول لك هاي شنو؟ تقول لي هاي collis fascia. شوف هذا الفيستيبيول اوف ذا فاجينا، في فتحة اليوريثرا وفي فتحة الفاجينا، وهاي الليبيا مينورا، وهاي الليبيا ميجورا، وهذا الكليتورس، وهذا البريبيوس اللي هي الليبيا مينورا enclosing the clitoris. I hope you're getting something, and thank you.